the healthcare industry should be about saving lives and improving well-being. But in reality, it's often more about profits than patients. In the United States, where healthcare costs are some of the highest in the world, a handful of companies dominate the industry. These corporations, fueled by billions of dollars in revenue, operate in a system where greed often takes precedence over human life. So how did we get here? And why do healthcare companies prioritize profit over care? Join us as we explore the complex world of healthcare companies and their impact on our lives. Let's start with the heart of the problem, the structure of the healthcare system itself. Unlike many other developed nations, the United States runs on a for-profit healthcare model. Insurance companies, pharmaceutical giants, and hospital networks have turned medical care into a lucrative business. But how do they make their money? They profit through high premiums, expensive medications, and complex billing practices. Patients often face denied claims and exorbitant costs, making healthcare inaccessible for many. This system prioritizes profit over patient care, leading to widespread dissatisfaction and calls for reform. The need for change is clear, as the current model leaves too many without the care they need. One of the most glaring examples is the denial of claims. Insurers are notorious for rejecting coverage, often for arbitrary reasons. A procedure might be labeled as not medically necessary, or a patient might be told they didn't meet specific criteria, even if their doctor disagrees. What happens when your life depends on a treatment that your insurance company refuses to cover? The consequences of denied claims are devastating. People are forced to choose between crippling debt or life-saving care. Families lose homes, file for bankruptcy, or worse, lose loved ones, all because a faceless corporation deemed their case unworthy. And yet, these companies continue to report record profits year after year. How can a system designed to save lives also be responsible for destroying them? The fight for fair treatment is ongoing, and the stakes couldn't be higher. So what companies are causing this to happen? Pharmaceutical companies, the second pillar of the healthcare industry. Prescription drug prices in the United States are astronomically high compared to other countries. Medications like insulin, which have been around for decades, cost hundreds of dollars a month, often forcing patients to ration their doses. But why are these drugs so expensive? The answer lies in a combination of patent monopolies, lack of regulation, and outright corporate greed. Pharmaceutical companies argue that high prices fund research and development, but reports have shown that much of their revenue goes toward marketing and shareholder payouts. How many lives could be saved if life-saving medications were affordable? The time for change is now. We must demand affordable medications for all. One of the most alarming practices in the pharmaceutical world is price gouging. Remember Martin Shkreli, the so-called pharma bro? He infamously raised the price of a life-saving drug by over 5,000%. While his case made headlines, it's far from unique. Many companies quietly raise drug prices annually, outpacing inflation and putting medications out of reach for millions. So, why aren't more people talking about this? The answer lies in the complex web of lobbying, marketing, and the sheer power of the pharmaceutical industry. Until we address these systemic issues, price gouging will continue to be a devastating reality for many. It's time for a change, and it starts with awareness and action. Hospitals, the third cornerstone of the healthcare industry, are equally complicit. Medical bills in the US are often incomprehensible, with charges for things like $10 aspirin tablets or $100 room fees. Even a routine visit to the emergency room can result in a bill running into thousands of dollars. Hospitals justify these costs by pointing to the complexity of healthcare delivery and the need to cover unpaid bills. But when CEO salaries soar into the millions and luxury renovations are prioritized over patient care, it's hard not to question their motives. How much of your hospital bill is truly about your care, and how much is about padding corporate budgets? The financial burden on patients is immense, often leading to debt and financial ruin. It's a system that seems to prioritize profit over people. And then there's the recent shooting of United Healthcare CEO Andrew Whitty, a story that's left many people shocked and speculating. While the details surrounding the incident remain unclear, it has sparked conversations about the broader frustrations with the healthcare industry. Could this act be a symptom of the mounting anger and desperation faced by patients who feel betrayed by the very system meant to protect them? It's a reminder of how high the stakes are when healthcare is driven by profit rather than compassion. As the investigation continues, the public remains on edge, waiting for answers and hoping for change. So, the question is there any hope for change? Access to healthcare is another glaring issue. The United States is one of the only developed nations without universal healthcare. Millions remain uninsured or underinsured, meaning they have limited or no access to essential medical services. This lack of access disproportionately affects marginalized communities, including low-income families and people of color. In these communities, preventable illnesses often go untreated, leading to higher rates of severe health outcomes and deaths. How can a nation that spends so much on healthcare leave so many behind? The call for change is growing louder as more people demand a system that works for everyone. Lobbying plays a massive role in maintaining this broken system. Healthcare companies spend billions of dollars each year lobbying politicians to ensure laws favor their profits, whether it's blocking efforts to lower drug prices or opposing universal healthcare proposals. These corporations wield enormous influence over public policy. Consider how often bills aimed at improving healthcare access are watered down or outright defeated. How much of this resistance comes from the sheer power of the healthcare lobby? The influence of lobbying is a significant barrier to meaningful healthcare reform, affecting millions of lives. But perhaps the most sinister aspect of corporate healthcare is its invisibility. These companies operate behind polished branding and marketing campaigns, presenting themselves as compassionate and community-oriented. They sponsor charity events, donate to medical causes, and advertise heartwarming success stories. Yet, behind the scenes, they're denying claims, inflating prices, and prioritizing shareholders over patients. How do we hold them accountable when their public image is carefully curated to deflect criticism? The challenge lies in exposing the truth behind their facade and demanding transparency and accountability. This isn't just about exposing corruption. It's about asking bigger questions. Should healthcare be a business at all? Can we create a system where care takes precedence over profit and where no one has to choose between survival and financial ruin? And most importantly, how do we as a society demand change from companies that profit off our health and well-being? If this video opened your eyes, don't forget to like, subscribe, and hit the notification bell. Your support helps uncover the stories they don't want you to know. Together, we can push for a healthcare system that values every life equally.